Now we will be studying about the posterior part of the norma basalis. In the posterior part of the norma basalis, in the midline, if you see, this is the posterior part of the norma basalis. In the midline, we find a large foramen, hence called magna or magnum. This is called as foramen magnum. You have this one which is called as external occipital crest, and this one is external occipital protuberance. So this foramen magnum transmits very important structures, and the best way to remember is having a mnemonic VAMPS ATM, wherein V stands for third part of vertebral artery, A stands for anterior spinal vessels, M stands for lower part of medulla oblongata and the meninges covering it, P stands for posterior spinal vessels, S stands for spinal roots of accessory nerve, A stands for apical ligament of Dens and alar ligament, T stands for tonsils of cerebellum sometimes, and M stands for membrana tectoria and meningeal branches of cervical nerves. Is it clear? So this is all about the structures passing through the foramen magnum. I repeat: vertebral artery, anterior spinal vessels, medulla oblongata, posterior spinal arteries, spinal root of accessory nerve, apical ligament and alar ligament, tonsils of cerebellum sometimes, and M for membrana tectoria and meningeal branches of cervical nerves. Now coming to the next part of it, that is this one. This one is external occipital crest, to which ligamentum nuchae is attached. And then we have here, this one is external occipital protuberance, to which in the upper part it is trapezius which takes origin, and in the lower part it is the attachment of the ligamentum nuchae itself. Now coming to the region by the side of this foramen magnum, these two are occipital condyles. They articulate with superior articular facet of atlas. These are the superior articular facets of atlas to form like this, to form atlanto-occipital joint, joint. Then we have by the side of this is condylar fossa, a depressed region present behind the occipital condyle is condylar fossa, which sometimes may show a foramen. When a foramen is present, it is called condylar foramen, which transmits an emissary vein. Just in front and above, or just above the occipital condyle, we find a foramen here. This is called as hypoglossal canal. It is called as hypoglossal canal, transmitting 12th cranial nerve, that is a hypoglossal nerve, and an emissary vein along with it. Then this part of the bone is called as the squamous part of the temporal bone. This squamous part of the temporal bone, in its upper part you can see the nuchal line. This is the superior nuchal line. This superior nuchal line, medial 1/3 gives origin to trapezius, and in the lateral part it gives attachment to this one, sternocleidomastoid above and splenius capitis below. I repeat, in the medial part it is trapezius origin, medial 1/3. In the lateral 1/3, in the upper part it is the insertion of sternocleidomastoid, in the lower part it is splenius capitis. The remaining portion of the bone, if you divide it into 4 quadrants like this half of the bone, if you divide it into 4 quadrants below the inferior nuchal line like this, the upper medial quadrant gives attachment to semispinalis capitis. The upper lateral quadrant, it is the oblique capitis superior. Lower medial, it is the rectus capitis posterior minor, and lower lateral, it is the rectus capitis posterior major. I repeat, semispinalis capitis, superior oblique, rectus capitis posterior minor, and rectus capitis posterior major. Then we have an important foramen here by the sides. This one is jugular foramen. This one is the jugular foramen, to which or from which the 9th, 10th, 11th cranial nerves emerge out. 9th, that is glossopharyngeal, 10th, the vagus, 11th, the cranial accessory. These three emerge out, along with, in its anterior part, it is inferior petrosal sinus. In the posterior part, it is the sigmoid sinus, which passes through this jugular foramen. And not only this, it also transmits tympanic branch of glossopharyngeal nerve, meningeal branch of occipital artery, and even auricular branch of vagus nerve. But the first 5 are the important contents, and those are 9th, 10th, 11th cranial nerves, as well as inferior petrosal sinus and sigmoid sinus. Rectus capitis lateralis is attached here, just behind the occipital condyle and to the side of the foramen magnum. Here it is the attachment of the rectus capitis lateralis muscle. Then we have this hook-like process. This is the styloid process, to which 3 muscles and 2 ligaments are attached. All together, those 5 structures together with this styloid process forms styloid apparatus. And the 3 muscles are styloglossus muscle anteriorly, stylohyoid muscle posteriorly, stylopharyngeus muscle medially. And the 2 ligaments are, to the tip it is stylohyoid ligament, to the lateral surface it is the stylomandibular ligament. Is it clear? So, now coming to the other part, this one is the mastoid process. This mastoid process lies posterolateral to the styloid process, to which sternocleidomastoid and splenius capitis is attached. And the region medial to this mastoid process, this one is called as the digastric notch, from where posterior belly of digastric muscle takes origin. And the region between this styloid process and mastoid process, you find a foramen here. This one is stylomastoid foramen, which transmits, or the exit of the facial nerve comes out like this. Mind you, the entry of facial nerve is this internal acoustic meatus. This is the entry. It traverses the ear cavity and it gets out from the stylomastoid foramen here. Not only the facial nerve exit, stylomastoid artery also passes. Stylomastoid artery 50% of the times is a branch of occipital artery, and occasionally or 50% of the times it is a branch of posterior auricular artery. That stylomastoid artery, from below it passes upwards through this stylomastoid foramen. This is all about the posterior part of the norma basalis. Thank you.